Israel's military admits firing a mortar shell into the courtyard of a United Nations school in Gaza. But Israel says the school was empty at the time and the shell could not have killed anyone. Palestinian officials have said 3 Israeli shells actually hit the school on Thursday, killing 17 people and wounding dozens more. The school served as a shelter for Gazans displaced by the conflict. The conflict is sure taking a toll on hospitals in Gaza. Everything from medicines to fuel to blankets are in short supply. Noor Harazeen has more now from the Shifa hospital in Gaza.
One of the most serious crises has been the current fuel shortage, most tragically affecting Palestinian hospitals, in which most of the fuel-powered electricity generators could stop working in the upcoming days, risking the life of whom are critically injured, premature babies and intensive care unit patients.
We didn't expect such operation on Gaza, and we already suffering lack of fuel and medicine. Now the situation is going from bad to worse. We need an urgent help from the international community. Our hospitals are suffering like never before.
Gaza is also suffering from a severe lack of medical supplies. Doctors in Gaza said that the medicine and medical supplies shortage is impacting the service they offer and they prevent them from treating the casualties in a decent way. I met with the Norwegian doctor and solidarity worker Dr. Matt Gilbert, leader of the emergency medicine department of University Hospital of North Norway, who said that the repeated closure of border crossings into Gaza has led to this acute shortage.
Shifa equipment is far below what is needed to handle this large amount of injuries, serious injuries. And Shifa is lacking sutures, drugs, anesthetics, spare parts for the machinery in the ICU. It's lacking blankets, it's lacking trolleys, everything you need to run a proper hospital.
Despite the arrival of few medical aid convoys, basic medical items remain in short supply. It is estimated that Gaza's hospitals are suffering from at least a 70% shortage in medicines, largely due to the border closure and to the big number of casualties that arrived to the hospital in the past 21 days, which were more than 6,000 people.
Despite desperately needed medication, supplies and equipment, doctors continue to try to save lives in Shifa Hospital, one of the territory's biggest medical centers. Noor Harazeen, CCTV, Shifa Hospital, Gaza.